So I just shot a video on female hair restoration, on everything you need to know. This video is specifically talking about lowering the female hairline. It's mainly geared toward women that are just born with a high hairline, but also has some relevance when I'm talking about women that are losing their hair. So you probably, and so I'm not going to talk a lot about the recovery. I'm not going to talk about expectation. That's going to be in a separate video, but actually I'm going to have that joined in on this video as well. Denny, who's filming this, will be able to stick that onto this portion of this video. So that'll be, if you're watching both videos, you'll hear that redundancy. You can cut that portion of the video off. But so female hairline lowering is one of my passions. I do this all the time. I do it for traction hair loss, for African-American females in particular. I do it for young women with high hairlines, etc. There are two major methods to lower hairlines. One is a surgical hairline lowering, and one is as a hair transplant procedure. I rarely do the advancements today, and the reason is I find that the transplant looks so much better for a lot of reasons. First of all, very rarely do women just have a segment in the middle that needs to be done. They usually have all of this done. And what's really interesting is even women that are born with a high hairline that I think, you know, I just need to do this much. I lift this back up and I see this huge frontal temporal corner that has miniaturization. So I can't build this thick wall here without building into these frontal temporal gutters. So what I found is, if you look for it, you're going to start seeing that there's a huge component of temporal hair that needs to be rebuilt, not just that central zone. So when you get that transplant going down, when you get the surgical advancement of the hairline and you have most of this area missing, you still need a transplant. So that's a huge reason for this. The other thing is I have complete artistic control when I'm designing it. When I'm going there, I can design whatever I want at what level I want it. The surgical advancement is also limited to scalp mobility. This isn't. If you have enough donor hair, I can move this as far forward as possible and really rebuild the hairline the way I want to. The way that I do a female hairline, I'm incredibly passionate about. I use 4.5x magnification. And most times I'm moving about 3,000 grafts in there. People think, you know, wow, what the heck? I mean, I usually use 3,000 grafts to cover a bald man from front to back. But the reason for this is I'm dense packing 1 and 2 hair grafts. And that way it looks so seamless. I'm using 5 rows of 1 hair grafts. I'm using 5 to 10 rows of 2 hair grafts. And then maybe in the back frontal temporal gutters, I'll be using 3 hair grafts. Other places, they're using mainly 2s and 3 hair grafts. Well, they don't look as natural. They look a little pluggy for female hairlines. I don't know why that is, but with women, it just doesn't look as right. So I go through that extra effort of doing tons of small dissected grafts, and that makes it look so much more natural. If you look at some of my close-up videos on my website, hairtx.com, you'll see how I create the pattern, the beautiful shape of that hairline. You can't do that with a surgical female hairline lowering. I can really build the beautiful, luscious design of a female hairline with lateral mounds, with a widow's peak, and all these little things just to make it fit your facial frame. So those are the key elements in talking about why I prefer a non-surgical, in other words, non-cutting technique in the front of female hairline restoration. But I encourage you to really watch the other video about everything to know about female hairline, and also female hair loss if those apply to you. A little bit about the nature of the procedure, the recovery, and the results. So the procedure is going to be done under what's called level 2 conscious sedation, which is just a little bit of anesthesia. It's like having a few cocktails. You're not going to feel the injection. I'm only provided for the first few minutes, but you feel so groggy that you sort of fall asleep for the rest of the procedure. It's a long procedure. Sometimes it can be 10 hours. But the nice thing is, unlike all the other places out there where they're doing it under oral sedation, you really don't feel that discomfort. You're very, very comfortable. You're not feeling anxious, and it's a pretty easy, painless experience. And the whole day you don't feel the weight of that time. By about lunchtime, I've already done my design, I've already done my harvesting, I've already done my closure, and you may not even remember me being in the room for 5 hours. But as you sit up, we're going to give you a lunch. In the afternoon, my staff are placing, and so you're going to feel like you're in my office for about 3 to 4 hours, and we're done about between 3:30 to 6:30 p.m. roughly, depending on how big the session is, how hard the dissection is, how fine the grafts we need to dissect. But somewhere between 3:30 and 6:30 will be done. At the end of the procedure, you cannot drive home. Someone has to drive you home, and then we're going to see you the next day, check on everything, make sure you're doing okay. So I want to talk a little bit about the nature of the recovery. So a lot of people ask me, what's the recovery like? So One is pain. Oftentimes my patients don't have very much pain. It's not that uncomfortable. Rarely, this morning I had to do it, a lady had some discomfort back here from yesterday. I just put some Botox in, believe it or not, knocked it out. I do that once or twice a year. I mean, it's very, very uncommon to have to do that. But my FUT strip procedures just don't hurt very much. It's not like what other places have where it's very uncomfortable afterwards. It really should not be the way that I do it, and I can spend an hour telling you about why that is. And if you have a question, I'd be more than happy to elaborate on why that is when you come in and see me. But in terms of the recovery, bruising typically should be almost none. I don't rarely see bruising. Swelling, only about 15%, 15% of my patients have swelling. That swelling lasts usually about 3 to 5 days. In rare cases, it can last 7 to 8. And again, 85% of my patients don't even have the weird swelling. If you have the weird swelling, just wear sunglasses, will cover it up for the first few days. Scabs are the biggest offender. You're gonna see weird scabs up here where I transplant. If you can have a hairstyle that can cover it, that's great. That would be really, really wonderful. And wearing the hairstyle will be able to cover the scabs until you can rub them off. The scabs are rubbed off in 7 days. And so that makes the recovery not so bad. The backside incision is pretty much hidden. You're not gonna see that even walking out of my office. So in terms of social contact, if you can cover this here and you don't have much visibility, it could be a day out. If you may have to wear a scarf or a baseball cap or something or a hat to cover it for that week. And that could be the nature of the recovery. Stitches come out about 2 to 3 weeks after the procedure. You don't feel very much discomfort with that, but it's pretty fast. In terms of going back to working out, I say listen to your body. Don't force yourself. Don't go crazy. Don't push yourself. The only thing is, you can shower 24 hours out after the procedure, a day afterwards, but no tub bathing where you're under the water or swimming for about 6 weeks. So I don't want you to be in dirty water if possible. The other things is traumatic sports. Nothing that can, impact, karate, something that would, hit you. That's about the only thing I would say. I wouldn't want that for about 6 weeks or so. Otherwise, in terms of just general working out, just listen to your body. And that's really what I would advise. In terms of when the grafts grow in, I've seen as early as 4 months, but honestly, it's oftentimes about 5, 6, 8 months that you start getting a good expression of things. And remember, women need oftentimes longer hair, and it only grows about 1 inch a month. So over time, it gets longer and longer and longer and longer, and so that full expression may take a year. But a lot of my female patients are quite happy between 5, 6, 8 months, but they're really full expression maybe 12 to 18 months out. Do you need a second transplant? My goal after one surgery is to get you done. But some of my patients come back and say, could I have a little more density here or there? And I would usually like to wait at least a year so that we let the hairs grow in, and then what you thought at 6 to 8 months you needed another surgery, you don't need it. And so I always encourage my patients to wait before we rush back to do another surgery. And plus, I want all the donor area to heal as well, too. And the reason I think my patients get such amazing results after a single session is, first of all, it's my design. It's obviously the protection of the grafts. It's also my staff, how good they are in terms of placement. They do amazing work. And then finally, it's the ATP hydrothermosol PRP and A cell, which are a mouthful to describe fertilizers, because the hairs have these great fertilizers that allow the hairs to grow better during the transplantation process. So I hope this video gives you a very large overview of everything you need to know about female hair loss and hair restoration from medicine to surgery.